Records should be protected against uncontrolled modification or deletion. The system should automatically recognize when records have been altered after initial recording. Let's assume you have generated an analytical result and sign it. Now you would like to be absolutely sure that nobody could change this result. If you sign it on paper, you will be able to see on that paper printout if anybody has changed the result. If you have the result in electronic form, you also can keep a copy and make printouts. If somebody makes a change to the record again, you can make another printout. However, it can be very difficult to recognize changes by comparing the printouts. Therefore, it makes more sense that the system itself recognizes when someone has changed the result. The best way is to record any changes in an audit trail. The third point here is probably the most critical technical difficulty caused by the rule. The system must allow accurate retrieval throughout the retention period. A time frame for the retention period is not specified in Part 11. This is specified in the predicate rules, and it may be 10 or more years. FDA's intention is that you should be able to regenerate your original results from the original or raw data. What you need are not only the raw data, but also the metadata and the same data evaluation software as used for the original result. The question is how to do this. Do you need to keep a museum of old computer hardware? Do you need to keep the original operating system and the exact version of the application software? Let's talk about this when we come to the recommendations. A few 483 observations have addressed this. Reprocessed data overwrote raw data. Data was modified without an audit trail. Data was deleted without an audit trail. And metadata were not archived, so that retrieval after several years is not guaranteed. The first three items would be a reason for a 483 observation, whereas item 4 probably not. The recommendation again is to look for software that takes care of audit trails. Define computer-generated time-stamped audit trail as part of the requirement specifications. You should specify the archiving period. This is the same as you used to do it with paper records and is determined by the predicate rule. Select proper storage media. This is not so difficult because the lifetime of these media is good. You should have a procedure to check correct content of the media after a couple of years. Don't save computer hardware and operating systems to meet the requirements of accurate retrieval. When you migrate to a new system, the FDA expects that it should be possible to make accurate and complete copies. Convert files so that they can be re-evaluated with the new system in the same way as with the old system. This means also the audit trail and metadata should be converted.